Hi, everyone, and thank you so much for joining us today. I'm Kelly Grant, the National Health Reporter for the Globe and Mail, and I'm pleased to be your moderator today. Before we get started, I would like to acknowledge that the Globe and Mail's headquarters is situated in the traditional territory of the Wendat, the Anishinaabe, the Haudenosaunee, the Métis Nation, and the Mississaugas of the Credit First Nation. Now, if you need any technical help during this webcast, please click the Help Desk icon at the bottom of your screen. And if you have some questions for our speakers today, please use the Q&A box on the right. We will be taking some of your questions a little bit later on. So today we're talking about artificial intelligence, or AI, in healthcare. We'll cover some of the ways AI is changing patient care. And we'll also talk about the knowledge and the skills that the industry will need to take advantage of these new technologies. We'll start with a brief interview, and then we're going to shift to a panel of healthcare practitioners and technology experts to dive a little deeper. The Globe is presenting this webcast with support from Microsoft. We're pleased to have a speaker from Microsoft joining us today, along with other experts who are joining us independently. So my first guest is Dr. David Wiltshire. He's the Executive Director of Education, Technology, and Innovation with University Health Network, or UHN. So thanks for joining us today, David, and let's just jump right in with some questions here.
Awesome. Thank you so much for the opportunity.
Okay, well, we're really happy to have you here. So I wanted just to start off getting you to talk a little bit about this new project that UHN has underway. So can we start there?
Absolutely. So I think, as everybody is aware, over the last little while, there's been a lot of buzz and activity around AI, and it seems to be everywhere. And in healthcare, there are there's a lot of conversation around AI, and there are lots of examples in AI. People talk about using it for process automation. They talk about using it to read images. They talk about helping with communication with patients. There's a whole spectrum. And in fact, if there's an area of healthcare, there's probably an AI tool out there. Yet the problem is that it's very difficult to implement these technologies and very challenging. And so through some funding through Future Skills Center, some very generous funding, we were able to put together a partnership between University Health Network, the Michener Institute, and the Vector Institute for Artificial Intelligence. And collectively, with some additional partners, we're trying to tackle this problem of how to help clinicians and leaders in organizations think about implementing the appropriate and responsible use of artificial intelligence to enhance and improve the quality of care. So we're focusing on three things. We're trying to create a conversation around mindset, skill set, and tool set. And so what does that mean? So first of all, we're trying to engage people in conversation. So what is AI? It's a broad general term. Try to engage people in thinking about where it could be used in their environment. And then once you engage in that conversation, it's okay, well, there are these possibilities. How do we actually go about implementing it? And that's where skill set comes in. So we're focusing on implementing two programs. One is looking at how we help clinicians become champions. And so we have a 6-week program. We take clinicians through the ABCs of AI and talk about concrete examples. And last Saturday, we just launched our leadership program to help leaders think about what are some of the opportunities and challenges for AI and try to accelerate that. And finally, once you have the knowledge and the skills, how do you start to think about this from the perspective of, okay, where do I get started? And so we're creating a program to mentor people and really align people who are interested in getting started with those who have expertise. And so try to strengthen healthcare across Canada by really thinking about how do we do this appropriately.
So David, when we were talking earlier, I was looking for some kind of concrete examples. And you mentioned to me one clinician who had found a way to solve a problem and turned it into a product. And I thought it was very cool. And I'm wondering if you can share that with everybody.
Absolutely. Thanks for asking. So, one of the things that we talk a lot about in the program is thinking about solving real clinical problems. And within my organization, we have an example of a physicist and a whole team who saw a problem. So when if somebody has cancer, one of the common treatments is radiation therapy. And if somebody goes for radiation therapy, there's a long process in preparation for the therapy. They get imaging studies done, usually CT, and then people behind the scenes have to look at those images and identify various structures, different organs and where the tumor is, and then they have to plan out where the radiation is going to go. It's a very long process, but it's also a very repetitive task. And so what this team did was they came together and they said, okay, how can we automate this based on all of the data that we have already? And so they developed an application that allows them to take a process that could normally take 4 or 5 hours, maybe even a day, and they do it within minutes, and it's working with the AI. So they set the plan and then they verify it. And then during COVID, some of their other colleagues came along and said, well, if we're taking these images and some of them involve lungs, maybe what we can do is build an algorithm that would look for any evidence of COVID. And so they also gathered another data set just by running an algorithm in behind the scenes. And in fact, in the literature, it says that machine learning is quite good at detecting COVID and being able to identify that. So you can see just by giving clinicians the tools that they see what the problems are and they can solve it. Can't always do it by themselves. Sometimes they need teams, they need to bring in expertise, and to scale that, they often work with industry partners as well.
So the group that was behind those two innovations you just spoke about were probably pretty enthusiastic about the work themselves, but how did you find other clinicians received this sort of new technology?
Yeah, it's an interesting conversation, and I would say a couple of years ago, as we really started in healthcare to talk about the role of AI, there was this sort of sub-conversation around, will doctors and other clinicians be replaced by robots? And there was this little bit of fear and so on. And I think that conversation has gone away a little bit. And people are rather talking about how do we use AI to optimize, to assist and augment. So the conversation has shifted a lot to where's this data coming from? How do I use these tools? What do I need to know to make decisions? How do I reassure my patients if this is being done from a technology perspective that this is safe? What support do I have from organization? Who's taking care of all of the elements behind the scenes? And there's a book called Reimagining AI in the Age of Machines, and in that book, they talk about the missing middle. And really, we're in the age of talking about how technology and clinicians can come together and be even better together. It's not about machines against people. It's about thinking about, boy, if we can figure out how to integrate some of these machine learning tools into our environment, we can maybe make superhumans in terms of what they can do and process the data and augment and enhance their ability to process all this immense amount of data that's happening around them. And then maybe we think about how we help those machines be more effective by interpreting what's going on and helping other clinicians and helping patients. And so maybe what will emerge are new roles in healthcare, like an AI therapist, somebody who uses those technologies to deliver care. So it's a really interesting time right now for us to be doing this work.
Yeah, I'm interested in you mentioning the idea of people being sort of concerned that this is, robots replacing physicians or nurses. One of the things that machine learning can't do is provide compassion to people who are sick and need a human touch. So how do you bring sort of digital compassion to these AI approaches?
Yeah, thank you so much for bringing this this notion forward. And a couple of about 2 years ago, an organization called AMS Healthcare, which takes as its mission to think about how to drive compassionate care with technology, set out on this journey to write a book called Without Compassion, There Is No Healthcare. And part of the centerpiece of this is how do we use technology in a way that we're attending to and alleviating suffering. So digital compassion is about thinking not necessarily of technology of being dehumanizing, but thinking about all the things we need to do to humanize the use of that technology. And I'll give you a couple of examples because that sounds a little bit, out there. Or what do we talk about? Compassion and technology. So even simple things like if we go on to a virtual care visit, supporting our patients as they go through that journey, making the contact, making sure that they feel attended to within that virtual care environment, that they feel supported, that they feel that their questions are being answered. So all of those things that happen, or if we're in clinic and a clinician is using the electronic health record, engaging the patient in that experience, that humanizes something that can be a little bit dehumanizing if that interaction isn't there. And finally, it's also about how organizations behave. So one of the things we talk about in digital compassion is how to create a digitally compassionate organization. And what does that mean? Well, a commitment to, if we're going to implement technology, we're going to think about this in a way that helps to improve equity, access, inclusion, and diversity. I'm sure some of my colleagues will talk about algorithms and ensuring that they promote equity and try to eliminate bias. But digital compassion, and as we talk about the role of digital compassion in AI, is an emerging field to really make sure that we don't forget about our core mission to think about our patients and our colleagues and try to recognize and alleviate any suffering.
Well, another place where I imagine compassion is really, really important right now is with the healthcare staff themselves. I mean, I can't even imagine what doctors, nurses, and other practitioners are dealing with on the front lines right now. Well, this pandemic drags on and on. So what are some of the things that you can do with AI to make sure you're actually supporting the people who have to deliver care in this new way, especially if they're really busy and they're thinking, okay, the last thing I have time to do right now is learn a new computer program?
Yeah, it's an excellent question. And I think one of the things that we've really talked about, especially during COVID and people being under such pressure, is how do we do automation better? How do we, like the example I gave you with radiation medicine, how do we take away some of the tasks that are repetitive, that don't have to be done? And so how do we use those technologies and AI to really help identify some of those issues? There's a lot of development work going on right now and looking at how AI can be used from everything from detection of COVID to treatment modalities. But a lot of these things are really, really novel and haven't necessarily become a widespread part of our practice. So one of the things organizations need to do is really think about how they can support the implementation of some of these technologies. And one of the things we're trying to do is think about how we support our clinicians and our leaders in having the knowledge and the skills to actually do this.
All right, well, I think we're going to have to leave things there. David, thanks a lot for your time on this. And just to let everybody in the audience know, David is going to be sticking around. So if you do have any questions for him later, he can join in after the panel to answer some of those questions. And speaking of the panel, that's where we are going to head now. So I'd like to introduce the members of our esteemed panel right now. So first up, we have Dr. Halia Mohammadi. She's the Chief Data Scientist and Healthcare Lead with Microsoft Canada. Also joining us is Tracy Risling. She's an Associate Professor with the Faculty of Nursing and the University of Calgary. Tracy's also the President of the Canadian Nursing Informatics Association. And we're also pleased to have Dr. Amol Verma joining us today. Amol is a clinician scientist with St. Michael's Hospital. He's also an assistant professor at the University of Toronto. So welcome everyone, and thank you guys all for your time. I'd like to start with Amal first. We talked with David a little bit there about a specific example of an AI program that was developed by clinicians. St. Michael's has a new project underway called ChartWatch. So could you start by telling us a bit about that project?
Absolutely. David nicely said that, with projects related to artificial intelligence, it's good to start with a problem. So the problem we started with was the problem of critical illness in hospital. So we know that about 5 to 10% of adults who are hospitalized with a serious medical illness may require intensive care or may even become so sick that they might die in hospital. But one of the important challenges for clinicians, for physicians, for nurses, is figuring out which of our patients are at the highest risk, who might need critical care or might need intensive care. And so our project is focused on using artificial intelligence to help clinicians identify the highest risk patients. And so what we developed is ChartWatch. It's an artificial intelligence tool that takes about 100 pieces of information that are captured routinely in our hospital's electronic medical record, and it uses those to generate an hourly prediction of which patients are at the highest risk of needing intensive care. And then the tool conveys that information to physicians, to nurses, so that they can treat high-risk patients early, so that they can intervene to try to prevent the need for intensive care, or that they can quickly deliver intensive care where it's needed most. And the goal is to really improve the quality of care we're delivering for our patients.
So how are you finding that's working so far, Amal?
Yeah, so we have been developing this tool over the period of the last 2 or 3 years, and it was implemented starting in August or September of 2020. We kind of started in August and rolled it out in a staggered approach through the fall of 2020. So it's now been live for just over a year. And the implementation has gone really well. I mean, we spent a lot of time trying to make sure that the tool integrated well with our clinical practice so that it was assisting our nurses, assisting our physicians, but not disrupting the things that they're normally used to, their usual work streams, their usual workflows. And it's been received very well. We have identified quite a number of patients in whom we've been able to deliver care earlier, identify problems that we might otherwise have missed, and improve outcomes. Our very early data suggests that we may have started to reduce some of the unnecessary or avoidable deaths on our inpatient units by up to about 10 to 15%. So we're really excited about some of the early outcomes. We're doing more to evaluate and learn how to use these tools better, but it's very promising and it's been a really exciting project.
That's very cool. Helia, can I turn to you next? And I'm wondering if you could give us a couple of examples of, where you've seen AI in healthcare in action working well.
Absolutely. Thanks, Kelly, and hello, everyone. When we think about how the world is evolving and the way that technology and AI is empowering everyone, especially during this pandemic, it's really evident that healthcare is one of the most urgent applications of AI. When we look at the different departments within our health sector, the different sections of our hospitals, AI can play an important role and will be even deeper integrated into our healthcare system in the future to assist different groups of users, from the healthcare teams and healthcare decision makers all the way to patients and family caregivers who are the end users of AI solutions. AI can be applied and in fact is currently applied, as Dr. Amal mentioned, in many areas of healthcare, including clinical analytics, such as post-surgery recovery prediction, or in the case that Amal mentioned, adverse event detection, where, for instance, cardiac events can be detected to notify the care teams prior to the event to save lives using vital signals such as heartbeat rate, or other forms of health data such as medical images. Another area is in operational optimization, such as using conversational AI or chatbots, which are one of the most commonly deployed AI solutions, for instance, for help desks, to decrease the surge of call volumes, or basically to capture symptoms for ER triaging, for example, or the health bot that Microsoft has developed that can determine if a patient needs immediate care or doesn't need to physically come to the ER, for example. AI can also improve patient outcomes through speech transcription and translation, either in text format or voice, which can improve communication between care teams and the patients whose first language is not English, and also using NLP or natural language processing, which is one of the areas of AI. We can help with physician burnout, which is one of the challenges of pandemic. Again, to mention another application of AI in healthcare that was emerged because of COVID. It's basically through image understanding and classification, as David mentioned, to assist radiologists and also to perform spatial analysis to count the number of individuals in the facility real time for social distancing, for example, or face mask detection. And finally, I'd like to mention that AI can have an impact in research and precision medicine. For instance, to find abnormalities in patient health records or to identify variants of concerns within the genes, for instance, COVID mutations, or perform single cell sequencing to really identify different cancer cells, to create a more tailored treatment plan for each patient, to make sure the treatment combinations can destroy the majority of the cancer cells while have minimal to no side effects on the patient. This is really personalized care, and I believe it is the future of healthcare, which can be brought into the care continuum if AI is combined with the power of cloud compute and storage.
Thank you so much, Helia. You mentioned burnout in there, and when I think about some of the professionals working in healthcare who've had to deal with really a huge amount of burnout, I think of nurses. And so I do want to come to Tracy and just ask where you think, Tracy, AI could potentially come in to help ease some of the burden on nurses.
I think it's a really important question. Thanks so much. And I think we've had some great examples here about, decision support, risk assessment. I think when nursing thinks about AI, we think about prevention. We think about the opportunities for this technology to help us address persistent inequities in social determinants of health. Certainly, we embrace the natural language processing and the potential of that to better represent nursing data in our existing electronic healthcare records data systems. But it's not just more efficient, I don't think. I think David touched on that. Nursing wants to know how we can use this significant technological shift to make healthcare more compassionate. And actually, the Registered Nurses Association of Ontario and AMS worked on a report that had 15 recommendations on that I think really outlines some actions. And it has calls out to kind of the widespread changes that are needed, I think, not just in nursing, but in healthcare education and ongoing professional development related to the skills needed to not only to help with the design and integration of AI technologies, but the evaluation of the impact on the health of us all.
Do you feel like enough of that evaluation is happening yet, Tracy? If you don't mind coming back to you, I'm interested in that.
I think I want to get to the point. I think I'm still working on the other end of the continuum, trying to encourage and equip folks, nurses in particular, to be engaged in the development of the technology and the foundational understandings that is needed to really be collaborative partners. I agree with the panelists. It's a really significant shift. It's happening even as the pandemic kind of parallels along, and I think it might lull us into a false sense of security that equipping practitioners to be able to be active partners in AI health technologies is a luxury or something we can wait on until we do other things or resolve some really serious issues that have resulted from the pandemic situation. But in fact, we can't wait, actually, because if we wait, there's going to be opportunities that will be missed. And so that's an issue that I've really been thinking about and trying to think about how we support nurses and other healthcare practitioners to be ready to step into this space.
Yeah, can I actually ask you a little bit more about that, Amol? Because when we were talking beforehand, one of the things that stuck in my head was you saying everyone thinks this is like, some sort of Skynet future thing that we need to prepare for a decade down the road, but it's not. It's here right now. So what are some of the ways that everybody who is involved in this world can help doctors, nurses, other people on the front lines actually deal with these new technologies like right now?
You're so right that I think when we think about artificial intelligence, it sounds so futuristic. We think about the robo-doctors like David was talking about. And there's two things. The first is that, exactly as you said, these technologies are working their way into practice right now, whether it's like the tool we've developed at St. Michael's Hospital, some of the things that Helia was talking about. Frankly, a lot of these technologies are currently directed at improving the tools that clinicians have to work with. And so patients may not even know that the care that they are receiving is being informed by artificial intelligence. And so to your point about how can we develop a healthcare workforce that is able to bring these technologies in and ensure that they are being used in a way that is compassionate, in a way that promotes humanism, makes healthcare better and more human for our patients, we really need two streams of things to happen. So the first is we need a relatively small cadre of clinicians, nurses, physicians, other health professionals, whether that be physiotherapists or radiation technologists, to understand these technologies at a really high level so that they can help develop the innovation. That's what Tracy was talking about. So that they can help people develop these technologies and innovate and start bringing that into the system. Then the second stream is really, what does everyone need to know? What do all the practicing nurses, all the practicing physicians need to know so that they can start using those technologies? So the broad knowledge really needs to be able to do three things. The broad clinicians, they need to be able to know, when should I use this kind of artificial intelligence-based technology? How do I interpret its findings? And then how do I explain it to my patients, right? And so that's really that core skill set that we need to help people develop. And I think we need to really, as Tracy said, we need to start on it kind of yesterday. And I think there's a good parallel, which is I have no idea how an MRI machine works, right? I have no clue what technology is, the magnetic stuff behind it. It's mystery to me, but I know exactly when to use it, and I know how to explain it to my patients and how to work with my colleagues to interpret it. And so I think AI is just another new technology for us in healthcare.
Absolutely. And Kelly, may I chime in to kind of give a little bit structure to different groups that are involved. So basically, I think there are three groups. Thank you. There are three groups that either build or leverage AI-infused solutions. The first group includes the innovators, the entrepreneurs and intrapreneurs, and basically what I like to call champions within their organizations who want to make a change. And this group includes either domain experts such as nurses, caregivers, doctors, or healthcare decision makers who are experiencing a challenge or a shortcoming that they believe can be addressed using technology and AI. And they're not necessarily building these solutions themselves. For this group, it's important to gain an insight on what AI can and cannot offer, and whether or not AI can solve that specific challenge at hand. It's really important that members of this group have a high level understanding of AI solutions, enough to be dangerous, if you will, and are aware of best practices, success stories, or even failed cases, and more importantly, skill themselves in areas such as responsible AI to really be able to determine whether the solution they're aiming to build or develop is ethical and follows core principles of responsible AI. This group basically brings incredible insights and domain expertise for the AI algorithms to learn from and mimic them. In simple terms, AI works best when it's augmented with human experts or augmenting human experts. Think of this group as teachers of machine learning algorithms who are able to explain what certain data sets mean or what information can be derived from certain data. Additionally, the domain experts play an important role in validating, improving, and correcting the results of AI solutions through monitoring or comparing the outcomes that are generated by AI solutions to that of a human expert. And that's of course possible if the second group that I'm about to talk about puts a feedback loop in place for any error correction and improvements. And the second group are really the developers of AI solutions, AI engineers, data scientists, data analysts, BI experts, IT and cloud architects who are really builders of AI. And I believe this group requires a different set of skill sets, as you can imagine, around AI, which is really more in the technical skill sets, but which it is really more in basically it's critical for this group to gain a level of skills to understand the domain and problem at hand better in areas such as problem solving, for example. As all of us may have heard about the wolf and dog classifier, this group may be identifying and solving for a different problem rather than the one that they were initially aiming to solve. For the ones in the audience who haven't heard about the wolf and dog classification story, the purpose of that solution was to distinguish between pictures of wolves and dogs, where they realized although their algorithm was performing great, it was really identifying snow versus no snow in the background because most of the wolves pictures were taken in the snow. And my point is there are these groups need to work hand in hand. As Amola and Tracy mentioned, basically to develop a reliable and responsible AI solution. And if I may, I would like to also add the third group, who in my opinion requires AI skilling, especially in healthcare, which are the end users of AI solutions such as patients, family caregivers, care teams. Even nurses fall under this group as well when they are the end users of the AI solution rather than being a part of building it. And I believe it's important for this group to understand how these AI solutions are designed really to build trust. That there have been efforts put into place to create a transparent algorithm that can explain what the specific AI solution, why it reached a certain decision, for example, or even why these solutions require feedback and data to be improved. As we know, the more data we have, the better machines can learn patterns and produce more reliable results. For this group, AI skills are really around what it really means to consent for their data to be used to improve AI technologies, and how much of their data is shared. Is it identified? Can they be in charge of their own data? And what are the contributions they are making in research and improvement of the healthcare system? For example, if they have rare disease, what differences their data can make to cure, and so on and so forth.
Okay, thanks so much, Helia. I'm really glad that you brought up both ethical and responsible use of AI, because as we're talking here, I'm getting some questions from the audience coming in. And one of the first ones that I got was, how can people be assured that their personal privacy is not being violated with some of these AI technologies? So could I get you to weigh in first on that, Helia, and then I'll maybe come both to Tracy and Amol on those points?
Absolutely. Maybe I can start by sharing our mission at Microsoft, which is to empower every person and every organization on the planet to achieve more. And adding a healthcare flavor to it, we'd like to empower the healthcare domain experts, clinicians, nurses, researchers, decision makers, IT, with not only the right tools, basically, but also to democratize AI for them to make the best data-informed decisions. And currently it's increasingly easier to infuse your solutions with AI compared to a few years ago. However, with such ease of access to building AI-powered solutions comes the responsibility of putting guardrails and guidelines around it to make sure the use of AI is responsible and ethical. In Canada, our health system really needs to infuse an AI strategy with policies and principles to make sure we consider different aspects of social impact, privacy, trust, and really look at every angle when we design and create AI solutions from day one. both from technical aspects and policy making. And, we need to make sure that the development and deployment of AI follows a set of principles to really maximize AI's potential and identify and remove or mitigate any risks. And, this is done through educating and skilling all the stakeholders and users who are in, any shape or form involved with AI-powered solutions. We have established Office of Responsible AI here in Canada, which I'm a member of, and it's led by John Wegold, our National Technology Officer. And it's in collaboration with our worldwide Office of Responsible AI and 2 other committees for engineering and research, which basically are setting the company-wide rules for AI. This Canadian team is specifically looking at any AI-infused solutions that are built on our platforms to really make sure they are following the core 6 principles of AI, which include fairness. As we know, AI solutions should treat all people fairly. Reliability and safety is the second principle, to make sure AI systems perform reliably in a safe manner. Accountability, which means that people should be responsible for AI systems. Transparency of the AI solutions, basically to understand and basically build a solution that is understandable and transparent, so we can explain why that AI solution reached a certain decision. And we have tools specifically to identify whether or not an AI solution is transparent. The 5th core principle is inclusiveness. AI systems should empower everyone and engage every people from any background. And finally, privacy and security. It's really critical that AI systems respect privacy and also are secure. We basically invest around $1 billion annually to make sure that our platforms are secure, so that AI solutions can be built on top of these platforms, in a secure manner. We also provide resources for our customers and our partners to build and shape their own ethical AI principles and their governance model that ensure they are building trust and collect, store, and use data in a responsible way.
Hi, thanks a lot, Helly. I appreciate that. Can I go to Amal next and maybe get you to address this data privacy question? And what have you done in terms of with ChartWatch as an example to make sure that privacy is maintained?
Yeah, it's a really important topic, and I think we got a great perspective from Helia about sort of the industry perspective, which is that companies that come to this space that are bringing the talent and the technologies that we need to develop and implement AI solutions have to do so responsibly. I kind of come from the other perspective of the clinician or the public health system perspective, right? In healthcare, we have a long history of having regulations in place that protect patient privacy. And those are essentially a model called a data custodianship in Canada. And so the healthcare provider that cares for you is the custodian of your healthcare data. They have to take care of it responsibly. And there are a lot of restrictions set out around what can be done with that data. Unfortunately, a lot of those rules and regulations could not have contemplated or anticipated the technologies that we're seeing today with artificial intelligence. So the idea of, for example, there's lists of what counts as personal health information, your name, your postal code, your date of birth, etc. So if you strip all of those out, maybe you can call data, it's sort of de-identified, it's privacy protecting. You can't link that information back to an individual. But actually, with artificial intelligence technologies, you can link things like, images or a variety of different points, and it's easier to re-identify because the computers are so powerful. And so at the same time, those artificial intelligence technologies can also help us mask data in a way that makes it more secure. So the regulations in our public system need to work to get to speed with the current technology, and they need to help us in the public sphere sort of work collaboratively with industries, but as Helia mentioned, really set clear guardrails around what can and can't be done. And right now it is a little bit of a Wild West with individual organizations that are the health information custodians, so in our case, our hospital, having to make decisions in sort of gray zones around what they are and aren't comfortable with. And so I think we do need some sort of more provincial and maybe even ultimately national leadership around this. I will say that at our hospital, for example, our ChartWatch tool, all of the technology has been developed locally, is deployed locally, and all the data sits locally. And so all of the privacy protections that are in place around the hospital's data systems, all the firewalls and security, et cetera, that all protects that data. So it all lives locally within our own hospital, which is fantastic until we start trying to scale that technology and use it in other hospitals, right? And implement it elsewhere, which of course is what we would love to do. We'd love other people to be able to take advantage of these solutions and benefit and have this in our public health system, share those benefits widely, right? But that's where we need that strong privacy protection. And the truth is, we're not there yet from a provincial and from a regulatory perspective. And this is where we really need strong partnerships with industry, with all of the right legal, ethical experts, with the voices of patients at the fore, helping us sort of make these new regulations for the new era of AI and the new digital environment of healthcare.
Yeah, so it sounds to me like both at a provincial level and maybe at a federal level as well, that we're a little bit behind as far as regulation goes in Canada. Do you have any idea why that is?
I mean, technology moves very quickly and governments do not move as quickly. I think there are a lot of incredibly smart people trying to work on this. We recently, Health Canada and the UK and the US released a joint statement of principles for good practices in machine learning for medical devices, which are sort of 10 guiding principles that will help sort of create future regulatory frameworks. And I think, there's a lot for us to learn from international partners around this, but we need to move fast. We need to move faster than I think we are on this, truthfully, because the technology is really fast.
Okay, thanks a lot. Well, I want to turn to Tracy now. I just want to pick up on what Amol was saying about how fast things are moving. And so I wonder if you can talk to me a bit about what you think needs to be done as these new technologies arrive sort of fast and furious to make sure nurses are prepared to actually use the technology well.
Thanks so much. And I really want to address that question, but if I could just make one point on the whole privacy data issue, because data is such a key driver of this technology, I just want to make two important points. Number one of the ways we can build data literacy skills in both patients and nurses, which is key to this pace of advancement as well, is think about things, why when I come to interact with the health system in any way, why is data use not part of informed consent? Maybe it is in some situations or some areas, but why don't we build that in more deeply into our informed consent? Because you know what? There's a value to the data that's driving this technology that's maybe not understood by patients. Patients' data is driving this system, and in my opinion, it shouldn't continue to be prioritized for delivery to advanced AI health technologies if it's not accessible to the patients themselves. So we need to support immediately more real-time digital access to health data for all Canadians. And there's some barriers in doing this, but if we address the barriers in getting this data out to patients, at the same time, we're actually building a critical infrastructure we need for the advancement of AI, one that can keep up with that pace of development. And there are other ethical issues, privacy concerns, literacy and engagement that we can work through by finishing the job we started, giving all Canadians reliable access to their electronic health data. Certainly, we've seen a surge in this as Canadians have come to rely more heavily on this data during the pandemic for testing results and for vaccination records. We should use this momentum to finish this job because it will help us really to build the foundation that's needed to be able to advance. And it'll help nurses as well, because the practitioners that are best positioned to help patients interact with their electronic healthcare data, make sense of it, take action on it, are nurses.
Okay, I'm definitely glad you brought up all of those points. So speaking of those nurses, can we talk a little bit about educating and preparing the nurses to actually do that work with patients that we're talking about here?
I think that there's a depth of knowledge and practice required when we think about developing generalist practitioners, right? Not just nurses, but other healthcare practitioners as well. And that density, right, that depth of knowledge can make curriculum innovation and evolution really challenging. First, just the sheer volume, but it's compounded by long-held traditions, not only on what should be taught, but on how it should be taught. And nursing informatics has faced a years-long, perhaps more honestly now a decades-long struggle in getting sustained uptake and use in nursing education across Canada. And this is, despite resource development by groups like my organization, the Canadian Nursing Informatics Association, but in collaboration with the Canadian Association of Schools of Nursing. So this is still a work in progress. But I think it's not just about curriculum. The content has to be reinforced. So the need for this foundational technological knowledge and even this specialized AI knowledge needs to be reinforced in accreditation principles, in national education frameworks for nursing, for medicine, for other healthcare practitioners. It needs to be reflected in our entry to practice competencies and eventually in licensure exams. And I think health and nursing informatics information is still not represented across that continuum really well. And I think it's because we still think that informatics is a specialty. So when we're in that mindset of generalist practitioner development, we still put informatics to the side in a box. But now more than ever, what we say at the CNIA is that nursing informatics is nursing. That's just the point in the evolution of healthcare that we are at. And so the knowledge needs to become a core aspect of not only clinician training and education, but ongoing professional development.
Okay, thanks, Tracy. So as I mentioned earlier, we're taking some questions from the audience, and I'm getting a few of them on my phone here. So I wanted to go to those audience questions now. I'm going to start with this one because I had a chuckle when I read it. Given that much of the Canadian health system is still paper-based, how does this impact the quality and quantity of available data? Because I have to say, as we've been having this conversation about all of this sort of really high-tech future stuff, I'm just reminded of how often I speak with doctors in my job who mention that they're still using fax machines. So maybe I could come to you first, Amol, to talk a bit about the challenges of trying to do this work in a world where a lot of stuff is paper and fax-based still.
Yeah, I don't know if it comes through on my screen here, the pile of faxed documents that are behind me in my office there. I don't know if you can see my records there. Yes, AI can only exist and thrive within the healthcare digital ecosystem that it is a part of, and there is no question that Canada's healthcare system has lagged in terms of digitization. And this has happened for a variety of historical reasons. One of the biggest challenges is that not only has healthcare digitization happened in fits and starts, but also it has happened piecemeal, so often led by individual institutions or organizations. So you have tons of different data silos, and it's really difficult to share data across organizations. And as Tracy nicely highlighted, as the consequence of that is an inability to share crucial information for patient care between clinicians and patients. And it's led to, frankly, real gaps in care. And to your point, Kelly, building AI technologies is with the underlying infrastructure being really poor, is like having a Ferrari on a pothole covered road, right? You can't go very fast. And so certainly there is, the pandemic has shed light, which, historically we've known this to be a challenge, but certainly it has accelerated the importance of building out the Canadian health data landscape. There are two incredible organizations, Pan-Canadian, that I've been able to contribute to and be a part of. One is the Pan-Canadian Health Data Strategy, which is thinking about how do we make these major investments and improvements in the way health data are stored and shared across the country. And the second is Canada's new Digital Research Alliance, which is thinking about how do we make the digital infrastructure available to support scientific innovation using data, and how do we ensure that it's secure, really bring Canada, to a position of leadership. Right now, Canada has less than half of the average G7 computational power. So we are lagging our peer countries when it comes to both public investments in data and research. So all of that to say yes, and that's why right now the AI innovation that you're seeing is happening in pockets, in specific organizations that have made major investments in data. And that's, I think, really a huge opportunity for us. The next 10 years will be our opportunity to improve the quality of data infrastructure so that we can really take advantage of these new technologies.
Okay, great. Thanks, Amol. I've got David has agreed to come back and join us for a couple of minutes here because I've got some questions that are directed specifically to him. So thanks for doing that, David. So this one specifically talks about the work you're doing with UHN and the Vector Institute. And somebody is wondering, if there are small AI businesses in Canada who want to kind of plug into that network, how do they go about doing it?
Oh, excellent question. So there's information about the program on both the Vector website as well as Michener. And there are lots of opportunities to have discussion and collaboration, because one of the things that we know is that we need to be able to harness some of these innovations and tools that small businesses and large businesses are doing. So I would say reach out. Well, we can have the conversation, and there's lots of opportunity to be involved in the education as well. So I think, as we've heard across the panel here, it's really a team effort, and educating everyone is so important, and involving so many different players is really key. So happy to engage if you reach out.
Okay, that's great. I've got one more question with you for you, David, if you don't mind sticking around. And that is, I have somebody here asking if you can tell us whether there are any AI programs you're aware of that are helping with chronic disease management.
That's an excellent question. I would say that there are a lot of tools being developed for different chronic diseases, especially on the prediction side, and trying to predict pathways of progression. Certainly in our programs, we talk about chronic disease, and we talk about tools that can be developed in order to help them. I think it also ties into what Tracy was talking about, is the engagement of patients. Because if you're going to do chronic disease management, patients have to be there. And I'll just, if you don't mind, give a 3 cheers for Tracy's comment about giving patients access to their information. That is such a vital stepping stone to laying the foundation for patients being able to enter and be part of this conversation of actually knowing what's there, how's that data being used, and that's a critical piece of chronic disease management.
Okay,
sorry
thanks
if
so much.
I did the 3 cheers, I couldn't help myself.
All right, thanks for coming back, David. We appreciate it. I've got a question now that's addressed to Helia. And I've got somebody here wondering whether you're aware of any AI applications that can help family physicians. We've been talking a lot about the sort of applications within the hospital setting, but what about family physicians who are working in their own practices?
Absolutely. So one of the areas that we touched on was around burnout. So there are, as we know, according to a survey conducted by Nuance, 85% of respondents agreed that one of the major contributors to burnout is clinical documentation. And as Amol mentioned, it's actually very tolling. And this statistics is also backed up by many academic studies. Physicians burnout or care team burnout was really a problem long before the pandemic hit, and it only got worsened. Even before pandemic, fatigue has been a big challenge within the healthcare sector, and healthcare professionals, including physicians, pathologists, radiologists, and really any healthcare professional that are specifically dealing with, for example, medical images, are spending prolonged periods of time on their computers, staring at the screen, analyzing medical images, doing prep work, do reporting, and oftentimes, double reading diagnoses, and especially with telehealth, looking at the screens for very long periods of time, and instead of spending their valuable time with the patients, which is what really matters the most. And we're really believe that AI works best as assistive technology and can reduce the fatigue and consequently decrease human error due to fatigue. AI can help alleviate some of the tedious work by simply drawing attention to certain area of a medical image, for example, or certain data that the physicians, family physicians need to look at, that require to, basically have a closer examination. And it can be also drawing attention to subtle yet important information that may have been missed by the human experts. I'd also like to mention that burnout is not just limited to medical images, as I mentioned, reporting and transcribing and translating the patient charts and filling out patient reports is another major factor. And we have technology that can listen to the conversation between the patients and a caregiver and maybe a family physician, and they can transcribe that conversation into structured data so that the physicians can simply copy and paste into their EMR solutions such as Allscripts, Epic, or Cerner. We recently announced our acquisition of Nuance, which is really a leader in providing the AI layer at the healthcare point of delivery. So these are really some of the examples that I can think of that physicians can really benefit, and also the patients who are visiting these patients can benefit from, as I mentioned earlier, if their first language is not English, they can receive that result or that difficult conversation in their own native language. I think that's very valuable to physicians as well.
Okay, thanks a lot, Helia. I want to come to Tracy next for another question I kind of get a kick out of here. Are patients, do you find, suspicious of having their healthcare delivered with an AI component?
I think that trust is a really critical conversation to have, and it's actually tied really close into discussions that we have about compassion and about collaborative care. So really, there's a really powerful triad there. I think I've seen some interesting studies. Either there's a really distinct lack of trust or maybe too much trust. And I think that there's a really important education component there. I think a lot of us just aren't aware how much machine learning or AI is really infused into our daily lives already. And we've had some really good commentary about that.
Okay, we've got about 4 minutes left, so I hope I can get a couple more questions here from my list from the audience. I'd like to come back to them all next. And I've got somebody here asking what training is needed to get physicians to actually use ChartWatch.
We thought a lot about how to train our nurses and physicians both to use the program. So in fact, from the very outset, the program was developed with their involvement because, so basically what does ChartWatch do? It creates a prediction score every hour that says this patient is high, medium, or low risk, and it alerts the clinicians when someone flips into a high risk status. So the next question is, so what? Like, what do I do for a high-risk patient? So we spent 2 years working with nurses, physicians from the intensive care unit, from our medical wards, from our palliative care service to say, what is the care pathway? What is the clinical response for high-risk patients? And then a lot of the training that goes in to our physicians, our nurses, and St. Michael's Hospital is a teaching hospital, so also our medical residents, is explaining to them. So we have a little sort of 10-minute presentation that every clinician that works on our unit gets, which explains what is the technology, what does the output mean? So what does high, medium, and low risk mean for each patient? So how can you interpret that information? And then what should you as a clinician do in response to that? And we have different things that the physicians should do, the nurses should do. A lot of it centers around communication with patients about their preferences. You know, one of the hardest things, this gets back to the key point that Tracy said about sort of compassionate care. One of the hardest things is knowing whether patients even want intensive care if they need it. A lot of older, frail people wouldn't want to be intubated, wouldn't want life support. So this gives us an opportunity to have those critical conversations earlier, maybe before people get so sick that they can't express their wishes. So our process really involves a lot of training for the clinicians that are using the system, but it's really focused around interpreting, using the system, and explaining it to the patients, like I talked about. Not as much about the sort of technical details of the machine learning algorithms.
Do you find it's difficult, Amal, to convince physicians to sort of give up some of their own control? Like, I just can imagine a lot of doctors saying, like, look, I know when a patient is at high risk for progressing to a need for intensive care, and I would rather use my own instincts and my own skills and my own training than rely on a computer. Is it difficult to get past that?
I mean, the really important point first is that there are a range of opinions, and so there will be a diversity of physician responses and nurse responses. But we start with humility. So the computer is definitely not perfect. There will be cases where the physician's judgment is superior to the computer's judgment. There are also 10 to 20% of cases where the computer's judgment is superior to the physician's judgment. And we know because we rigorously tested that. And then importantly, it's the combination. That's the whole thing about sort of augmented intelligence. It's that the physician intelligence plus the computer intelligence improves the overall result for the patient. And so we tell our clinicians to use their own judgment, to consider the computer's recommendations, and then respond accordingly. And importantly, there's no specific prescribed action other than go see your high-risk patient and decide for yourself if they're high risk or what the next steps are. And so it really is about actually encouraging physicians to be more of what they're already good at, to get to the bedside, to interact with the patients, use their diagnostic skills and their communication skills. And this is really about just providing another piece of information for them. So I think, when we think about AI technologies in general, that human-computer interface is really important. And if done thoughtfully and with humility about both the technology and about human abilities, it can be overall really powerful.
Okay, I think that's a great place to end things because we are out of time now. So I want to thank everybody who joined us today. And in particular, I'd like to thank all of our panelists for giving us so much great insight and so many things to think about. For everybody who's watching, if you're registered, you will get a link so you can see a recording of this panel if you want to watch it again later or share it with anybody. So thank you guys all so much for your time. We really appreciate it.